Hi, everybody. I'm here once again with Pinecrest Mayor Joe Corradino. It is Friday, April 17th, and we've got a lot of water under the bridge, so to speak. We've all been doing this flattening of the curve by staying inside. And Joe, let me start off personally. Tell me about how your experience has been and what you've been doing inside your house and with the family.
Hal, I've been staying home. Haven't really been out of the house except to exercise for, I think it's close to 6 weeks right now. So I'm settled into quite a routine. I'm sure everybody feels the pain of settling into this routine. It's a little bit different. I think I'm much more productive in the house. I mean, holding meetings in this format has reduced a lot of the wasted time that I have driving. I get done 2 days worth of work in 1 day now. So from that perspective, we're making do.
You're superhuman through Zoom. And so, we've been doing pretty much the same thing. It's really only going outside for exercise and to get some food. I don't know about you. We've actually become pretty good cooks and bakers here. How about your household?
Yeah, at least I think that's the case. I can't wait to taste normal food, other people's food again. Wouldn't be bad to go to a restaurant in the near future, but we're learning.
Agreed. Well, with that, let's get back to flattening the curve. That was the rallying cry from the top down. And I think that not only the nation, but certainly Pinecrest has responded. Tell me what's been going on. What do the police have been saying for Pinecrest residents and during their patrols? What's going on with Pinecrest in general with flattening the curve and doing the right thing?
Well, Hal, I think that the message for the week is of cautious optimism. We need to we need to be patient, stay the course, continue to stay home. In Pinecrest, I believe we're complying really well to this. Our police are out vigorously enforcing our rules and really not having an issue. We're looking at all the stores every day, all the construction sites. We're finding largely compliance, and when not, we're entering in. We're informing how to comply. In most cases, people are doing a great job. We don't really go back the third time, though. If you're not complying after the second time, we're shutting you down because we can't afford to risk anybody's lives. So we're looking good. I think the number of cases by zip code, Pinecrest is pretty low, which is encouraging. Countywide, we maintain a significant number of hospital beds, a significant number of ICU beds, and a significant number of available ventilators. All those numbers are up from last week. And for the first time, we're able to see the number of people currently hospitalized. That number is actually stabilized, and for the last couple of days, it's gone down. So it's too early to tell yet. We need a little bit more data, a little bit more water under the bridge, but we're there. Now, there are problems too, Hal. We don't have enough testing. We don't have enough masks and gloves, and we really need those before we can come out of it.
Well, one of the things that I found interesting is the last session that we had online here, I had some information coming from Baptist Hospital Systems, and of course it was just a prediction. They were saying that they felt that the peak of it for South Florida was going to be in the first week of May. Here we are mid-April. And it looks like, based on what you're hearing and seeing, that we may have actually done better than we expected. Do you have any direct information from Baptist or something from a reliable source that you know of that maybe the typical viewer wouldn't, that can tell us whether or not we're kind of ahead of the curve of flattening the curve?
Yeah, we get these numbers every other day directly from Miami-Dade County that puts all the numbers together from the entire health system, not just one hospital. I would hesitate to say that we are at the peak or have flattened the curve. I think we still need some time to tell. I think in another week we'll be able to see better off where we are, and that's why the message this week is cautiously optimistic. I think what we see to date, we've performed better than expected. And if that trend continues, there's a light in the middle of this tunnel. I think we can begin to start to have a conversation about how to look at the least risky things and open them back up. In fact, there's a conversation ongoing about maybe we should start to look at our open spaces, parks, beaches, marinas, golf courses, those types of things countywide. So that's hopeful, but I want to be cautious this week. I think we need another week.
I know that you're hesitant to talk about things that are really happening behind closed doors, but can you at least explain to viewers that there are those conversations going on, and maybe even explore what the topics are, because I know that there is no solution right now, but I think it's already encouraging what you're saying, and we can even get more excited about the fact that certain conversations are happening.
Yeah, when we started this venture, there were basically 35 different messages. There's 34 cities in the county, and the messages were all over. Everybody had their own plans. Since then, it's really remarkable. The cities have come together. We're working with Miami-Dade County. We've crafted together an umbrella message that the county has put out. And now the cities are able to use that umbrella message, and they're able to customize it for their individual communities. And this partnership gets stronger and stronger each week, which is going to be really helpful as we go forward. And we're meeting very frequently. All of this, I'm in contact with the other mayors in South Dade daily. We are meeting with the county and their professionals every other day. And we are, as a group, all of us, all the cities in the county and the healthcare professionals and industry leaders are working on this problem. We're modifying the plans on a daily basis. We're strategizing for how to come out of it. And I think we're going to do much better than expected.
Let's talk about the power of opening back up. So as you know, that all the way up to the presidential level, there is a conversation about we want to open back up. Now, when that'll happen is part of the process. But as you can see, there's some dissension between presidential level with governors of states, and we can work that all the way down to the level of Pinecrest, in this case. So you were talking earlier about how the shelter-in-place initiative really started for us here in Pinecrest. And do we have kind of a reversal of that on how we get out? Do the parks open in Pinecrest only? Do they open across the county? What granularity do we have, or does you and your government have to open us back up?
Yeah, first off, this is an apolitical event, and I believe that all the leadership in Miami-Dade County has treated it that way. I'm sure that all of us have our political differences one way or another, but I haven't seen it in the last 6 weeks. Everybody's on the same team with this thing, and all that we'll argue at a later date, but now we're all together. Yeah, we came into this with multiple different plans. In the last 6 weeks, we've gotten together, and there'll be one plan for coming out. Remember, we shut this down ourselves, Miami-Dade County and the cities, not the state of Florida, and I believe the governor has told us that we can open it up on a regional basis. So what I know is happening, that not only Miami-Dade County and the cities are going to come up with a unified plan that is crafted not by politicians, but by industry leaders, medical professionals, scientists, those types of things. But we're also trying to bring together Monroe County, Palm Beach County, Broward County to come up with a 4-county plan for how to address these things. Now, of course, we're not going to be in total alignment, but I think those types of conversations are going to be beneficial because we don't need the confusion going forward. So it's very confusing getting into this, but coming out of it, it won't be.
Got it. And of course, the goal right now is to, avoid the cabin fever that we are all experiencing. And yes, of course, financially getting the economy and our local businesses back up is important. But we're also hearing that undertone, which is a conversation about making sure that COVID-19 doesn't have a resurgence. Is that part of the conversation that's happening at the regional level as well? And what do you think about, maybe how a restaurant might reopen, or how a public park might reopen with different rules or behavior patterns that you'd like to see?
Yeah, I don't think we're ever going to see ourselves behaving like we behaved before. I think we're going to be back to full force, but we're also going to be operating in a little bit different manner. So yeah, those conversations are happening. Remember, the goal here was to protect the hospital system, make sure that anybody that needed critical care would have critical care. And if we did that, we would save lives, and we're doing that. And so every decision that's made is going to be informed by that, by data analysis, and by science. And so as we start to come out, we'll start to reform the rules. Again, right now we're looking at the open spaces. Soon we're going to have to start looking at the other things that aren't deemed essential right now: retail, restaurants, those things. So I would imagine, and this is something that we're in discussions with right now. It's by no means final. We may ask people to wear masks, right? We may ask tables to be further apart from one another in restaurants. We may employ the spacing requirements that are in the Publix and the grocery stores and the essential businesses right now as we go forward and apply that to all that. And then perhaps those of us that can work at home kind of secede the right of way for those of us that can't work at home. So for instance, the retail guys, the waiters, the waitresses, those guys need to go back, but maybe some of us that I don't know what percentage, the 20 or 30% that can keep doing this at home should keep doing it at home. Because the disease isn't going to go away. We're going to have to keep monitoring that. And as the infection moves through the population, which it must do, there's no way to stop it, just make sure that we're maintaining the hospital system as we go about this.
Joe, we illustratively used the pool at my condominium complex as part of our conversation in prior sessions. And of course, you're still welcome to come over and use the pool. The question really is,
I'm coming over for that pool.
And you know what? We'll have drinks and we will stay socially distanced. But I want to use the pool as a particular example because we've learned a lot about how this virus operates. And it is, it's material that is surrounded by a fat tissue, an amino. So when you go into water, it actually breaks down that fat and kills the virus. So a pool is one of the safer public places to be, at least when you're in the water. So what's interesting to me is obviously people don't just go in the pool, they touch the railing, they sit in a chair. And if somebody else was to go there right afterwards and the first person happened to have COVID-19, how are we going to kind of get to that point where we educate the public? And what role could Pinecrest play in the continuing education so that we can come out of this as strong or stronger than we were before?
We're in that process right now. In fact, by I think at 1 o'clock this afternoon on Friday, there's a task force that's working on that right now. The mayor has put together professionals from the industries that are looking at, like I said, beaches, parks, marinas, golf courses and such. They'll all be coming back with recommendations for how to go about opening those things. The plans are gonna have to be smart. They're gonna have to be done with consensus. They're gonna have to be nimble. There's gonna be rules, and we're gonna have to strictly enforce it. And then we're gonna have to let everybody know what the rules are. So those are a work in process. Pinecrest is directly participating in the formation of those rules. And I think that we'll have some more firm recommendations in the coming days.
See, Joe, I have to educate myself because I said the word amino, and what I really meant was lipid. It's a lipid, meaning a fatty tissue around the actual virus. So we're all going to have to learn to figure this stuff out and go, move forward in an educated way as best we can. And clearly I showed my lack of education right there. But the other thing I wanted to do was to thank the leadership in Pinecrest, thank the staff. Obviously, we have not felt this wrath of COVID-19, and a lot of that has to do with the local government. So my little hats off to you. I know that you like giving out your phone number. Curious if you've had any phone calls that are of particular note. And then at the same time, I think both of us would like to tip our hats to those restaurants that are doing takeout and doing it so carefully in the right way. The delivery folks and the people that frankly are keeping us sane. We're all stuck inside, and there are a few key people that have given us some sense of normalcy through all that. And I definitely want to make sure I recognize them here, and I'm sure you do too.
Yeah, that's great. There are two things. One, you asked me about the telephone calls and emails. I'm going to save those because every year, like in my State of the Village, I talk about some of the most remarkable emails or phone calls I've gotten. I've gotten some doozies, and
remarkable is a very good word. That's a political smart word.
Yes, and just to share, I mean, there's a lot of stuff that goes out there. Well, I'm not going to, it's pretty good.
Okay.
When we're all done with this, I'll share it. The other thing I want to say is that, look, whatever we're doing in Pinecrest or Miami-Dade County is a voluntary effort, right? People have talked in the past about lockdowns and curfews and those types of things. Not that we needed them or not, but we can't really enforce the stay-at-home orders. There's not enough resources. We don't have an army here. This isn't a lockdown. So everything that's been done has been done by the citizens of Pinecrest and Miami-Dade County on a pretty much voluntary basis. And that's what's really impacted the trajectory of this disease. Because if you looked at this in early March and you looked at a projection, it would have scared the heck out of you. And it did. And we've all basically stayed home for going on 7 weeks now. And we have had definitely a positive impact. So my hat's off to every single person in Pinecrest and Miami-Dade County. Couldn't be more proud to be part of a community than we are right now. So if you need me, call me. I'm at 305-606-2364. I got nothing to do. I'm sitting around the house 24 hours a day, looking at my phone, waiting for people to call. So that's my life. I'm
looking forward to the time when you'll be sitting by my pool and we can have a little drink and laugh and look back on this as hopefully being a small bump on the road of life. But right now we're all in it. Stay sane, as I have always said, be kind to each other online and to your family members that are right next to you. Joe, you're the best. I also want to put it out to the entire council in Pinecrest. Great job. And we'll see you next time when we need to. Joe, anything else for the public? Yeah, I just want to give a shout out to the entire council in Pinecrest and the staff. This council is remarkable. Never seen a group of people work together as well as this. No sniping, no bickering, no theatrics. Everybody's working hard, taking phone calls every day. Just a great group of people. Same with our staff, all pulling in one direction. And in local government and politics, that's very rare. So I just want to thank each and every one of them for doing a great job. There you have it.
You do great work, man.
Thank you very much. Enjoy your weekend. Everybody out there, enjoy your weekend. And we'll see you again with Joe, hopefully with even better and better news.